Good morning, friends. I am Dr. Shikhar Gupta, and I am a ENT consultant and head and neck surgeon. And I am associated with Max Hospital Shalimar Baug and have my own practice in Rohini, Sector 9. So today we'll be discussing about chronic tonsillitis and adenoids. सो एडिनॉइड्स एंड टॉन्सिल्स बहुत कॉमन टर्म है, हमने सुना होगा कि बच्चों में टॉन्सिल्स हो गए, एडिनॉइड्स हो गए. सो आज उसी के बारे में आई विल बी डिस्कसिंग. Basically, tonsil and adenoids are first-line defense mechanism which provide us immunity, especially in children, but they have their role till age of 5 to 6 years. And beyond 6 years, this role is taken over by other immune mechanisms in our body. If a child is suffering from recurrent sore throat, fever, and it is happening over and over again, not subsiding with antibiotics, then and the episode is more than 4 times in a year for which child is requiring an antibiotic, then we label it as chronic tonsillitis. And similarly, what are the symptoms of adenoid hypertrophy? Adenoid hypertrophy, common symptoms are children often suffer from disturbed sleep, snoring, mouth breathing, drooling of saliva, abnormal behavior, poor school performance, and also difficulty in gaining weight. So these are very serious concerns which child is continuously visiting his or her pediatrician and not able to cope up with the routine life. And also both these adenoids and tonsils, they are a part of sleep apnea. Basically sleep apnea क्या होता है, जिसको हम commonly खराटे कहते हैं. So ये उसी का पार्ट है जो कि in future it can lead to very other chronic illnesses. There are two ways. Commonly, when we are dealing with children, parents usually have a concern. They want a non-surgical treatment कि क्या हमारा बच्चा दवाइयों से ठीक हो सकता है. So my answer is yes, ठीक हो सकता है. There are both the options available, medical management as well as surgical management. So initially, when a child comes with adenoids or tonsils problem, we deal with medical management first. We give a course of antibiotics, some nasal sprays, some anti-allergics, and on a routine follow-up, if the child is doing well, then we follow up with the medicines and do certain routine investigations like a nasal endoscopy or a X-ray to confirm whether adenoids and tonsils are shrinking or not. And if it is responding, then the surgery is avoidable. But when do we do surgery? So now comes the important answer. Like everyone is concerned कि हमें कब निकालना है इसको, कब निकालना है. So surgical options nowadays are very safe. So there are certain indications. Tonsil surgery, we do tonsillectomy. If the child is not responding with antibiotics, he is constantly missing his schools, he is having very high grade fever, and this is happening over and over every month, then we advise tonsillectomy. And nowadays, tonsillectomy is done with the help of a coblation tonsillectomy, which is a kind of, in a layman term, you can say laser or a plasma mediated surgery, in which there is a very minimal blood loss and recovery usually happen within 4 to 5 days. We do adenoidectomy when the child is not responding with nasal sprays, he is having constant disturbed sleep, he is often waking up in the night, and he is having daytime sleepiness, poor school performance. One more concern which adenoid causes is a poor denture formation. So child often has a high arch palate. So in that cases, we do a coblation adenoidectomy. After, if only adenoidectomy is done, usually 2 to 3 days of bed rest is required, and child can immediately resume his or her school activities. And similarly, in case of tonsillectomy, usually this recovery phase extends to 5 to 6 days, because post-operatively slight pain is there, which we manage with the oral painkillers. And so lastly, my opinion is, if any of your child is suffering with adenoids or tonsil problem, do visit your nearest ENT surgeon and take his or her opinion. It can be managed either with the medical management or with the surgical management, and both options are very safe.